Hello, everyone. So if you're part of our dental faculty, you've probably been hearing the term programmatic assessment popping up more and more. But what does it actually mean for us, for our teaching? The whole point of this explainer is to cut right through the jargon and get to the heart of what this is, why it's so important, and how it's really going to shape the future of our curriculum. So here's what we're going to cover. We'll start with the big picture, the new philosophy behind all this. Then we'll dig into the why this approach is gaining so much traction. After that, we'll get into the nitty-gritty of how the system actually works. We'll touch on what it really takes to implement this kind of change, and we'll wrap up by clearing up a common question. What's the difference between programmatic assessment and EPAs? All right, let's dive right in. The most important thing to get your head around is that programmatic assessment, or PA for short, isn't just about a new set of tests or tools. No, it's a fundamental shift, a whole new way of thinking about the very purpose of assessment in the first place. This quote absolutely nails it. For so long, assessment has been about judging. It's been an assessment of learning. You know, that final exam, that grade, that thing that happens at the very end to see what someone learned. Programmatic assessment completely flips that script. It's about assessment for learning, where we use every assessment opportunity as a tool to actively guide and improve a student's development as it's happening. So what is it, officially? Well, programmatic assessment is a holistic system. And you gotta focus on two keywords there, system and multiple data points. This is not about one big exam. It's an integrated approach that pulls in information from tons of different sources over the entire curriculum. And why do we do that? For two critical reasons. One, to give continuous, meaningful feedback that helps students grow. And two, to make sure that when we do make those big decisions about their progress, those decisions are rock solid and backed by a mountain of evidence. So why the big push for this now? Is this just the latest trend in education? Absolutely not. This is a really logical and necessary evolution, and it's being driven by a much larger shift in how we even define what a competent dentist is. The number one driver here is the move to competency-based education. Curricula today, including our own profiles framework, are all about outcomes. It's not just about what a student knows, but what they can actually do. A traditional system that just tests knowledge on a written exam, well, it just doesn't fit anymore. Programmatic assessment is the missing piece. It's the assessment framework that's specifically built to measure and develop those real-world, hands-on competencies. And this really lays it all out, doesn't it? On the left, you've got the old way. A few isolated tests, a midterm here, a final there, all focused on a single grade. But look at the right. The programmatic model is all about creating a continuous conversation, a feedback loop. It weaves together lots of smaller, lower-stakes data points to build a much richer story of student progress. It uses assessment to steer learning, not just to stamp it with a grade. So what are the payoffs? Well, they're huge for everybody. For students, this system helps them take ownership of their learning. They're constantly getting actionable feedback, so they know exactly where they stand and what to work on. And for us, the educators, we get a far more complete and accurate picture of a student's abilities. This means when we have to make those big calls about whether a student is ready to move on, our decisions are not only fairer, they're way more defensible. All right, so let's get into the nuts and bolts. How does a system like this actually work in practice? It's really all about being smart and deliberate in how we collect and use information about our students. Think of it as having two levels. The foundation is built on a ton of low-stakes data points. These are things like direct observations in the clinic, case write-ups, self-reflections, you name it. The purpose here is 100% about feedback and learning. It's a safe space to try and even to fail. Then you have the second tier, the high-stakes decisions, like progressing to the next year or graduating. But here's the crucial part. Those big decisions are never based on a single test. They're made by looking at the whole picture, by adding up all those low-stakes data points over time. I love this analogy because it just makes so much sense. Traditional assessment gives us a few snapshots. A final exam is just one picture, taken on one day under specific conditions. Is that really enough? Programmatic assessment, on the other hand, gives us a rich portfolio. It's like a documentary film that shows a student's journey, their growth, their struggles, and their triumphs over time. Which one would you rather have to decide if someone is ready to be a dentist? So, what do you need to build this? First, you need a central hub for all this evidence, usually an e-portfolio. You need a mix of different assessment tools. Because one size doesn't fit all, you need to gather data from multiple angles, from faculty, from peers, from patients. And of course, high-quality feedback is the fuel that makes the whole engine run. But maybe the most critical piece is the Clinical Competency Committee. This is the human element, the group of experienced faculty who review the entire portfolio and make that holistic, informed judgment call. Okay, this all sounds great in theory, right? But how do we actually make it happen? Bringing a system like this to life is a major undertaking, and it's so important that we're realistic about what it really takes. And the first thing we all have to get on board with is that this is not a weekend project. It's not even a semester project. We are talking about a major curriculum reform. A successful rollout has to be planned strategically over years, not months. It takes time, it takes resources, and it takes patience. So what does it take to actually pull this off? Well, a few things are absolutely non-negotiable. You have to have buy-in from everyone, faculty, students, and administration. You need solid technology to manage all the data. But honestly, the most important ingredients are faculty development and a real culture change. We as faculty have to become experts at giving frequent, constructive feedback. And that's a skill. That's the real engine that's going to drive this whole system forward. Okay, last big topic. And this is a really common point of confusion, so let's take a minute to clear it up. Where do Entrustable Professional Activities, or EPAs, fit into this picture? Are they the same thing? Are they competing ideas? The good news is the relationship is actually very simple. They're partners. Let's break this down. The easiest way to think about it is this. An EPA is the what. It's a specific unit of work, a real-world task, like performing a simple extraction. It defines what we need our students to be able to do. Programmatic assessment is the how. It's the entire system we use to collect all the evidence to decide if they're ready to be trusted to do it. So an EPA is a data point that feeds into the much larger programmatic assessment system. Here's the bottom line, plain and simple. We use our big programmatic assessment system to gather lots and lots of evidence over time. And based on all that evidence, we can then make a confident, high-stakes decision about whether a student is ready to be entrusted with a specific EPA. They work together perfectly. So let's wrap this up. What are the big things to remember? First, PA is a huge philosophical shift to assessment for learning. Second, it's a whole system, not just a new test. Third, it gives us a much richer, more valid, and more defensible picture of our students' competence. And finally, remember that EPAs are the what we're assessing, and programmatic assessment is the how we assess it. So I'll leave you with this question to think about. The real promise here, the exciting part about programmatic assessment, is that it gives us a real answer to this. It provides a framework where assessment stops being a barrier for students to clear, instead becomes one of the most powerful tools we have to actively build the next generation of competent, confident, and self-aware dental professionals. Thank you.